Ladies and gentlemen, I cannot help feeling that this opportunity to speak to you all as nurses throughout this country can only be a hopelessly inadequate attempt to thank you more than I and so many others can ever say for your truly remarkable achievements during what can only be described as this interminable and most dreadful pandemic. Over the past year, you have quite rightly been in the forefront of the public's mind, even as you have been on the front line of our marvellous National Health Service. Not for nothing have you been described as the heroines and heroes of the hour. And I suspect that it is not widely understood, for instance, that many nurses have had to step outside their normal roles into completely unfamiliar settings in order to help deal with this pandemic. Not only ward and outpatient nurses going into critical care, but also paediatric nurses looking after adult COVID patients. Of course, the same is true for the whole NHS team, where consultant surgeons have been finding themselves working as healthcare assistants in critical care, pharmacists starting work at 0400 to prepare vaccines, and physiotherapists working as ward nurses. In more ways than one, so many different healthcare professions have been responding heroically to the unprecedented demands. Above all, I know you have gone far, far beyond the call of duty, and for much longer than would have been thought possible. In so doing, you have been an immense credit to the nursing profession and an unforgettable inspiration to our country as a whole, particularly as I am only too aware that you have had to face the kind of soul-destroying traumas and challenges that most of us can hardly imagine. As a result, the toll on your reserves of inner strength and your physical and mental endurance must be more draining and often heartbreaking than those of us outside the health service can ever comprehend. This is why, as we approach a year since the start of this long and unbearably grueling campaign, I just wanted to take a moment to say how very special you are, how lucky we are to have you, and how deeply appreciated is the work you do. Your vital, utterly selfless contribution in saving lives and providing the highest standards of care and compassion should never be taken for granted. I've heard innumerable, profoundly moving stories of nurses responding with dedication and commitment under the most impossible of relentless circumstances right across the health service, from treating very sick patients in specialist hospital units to providing care and advice as district nurses, as health visitors, midwives, school nurses, and as GP practice nurses. Many of you, I realize, are extending yourselves still further with your involvement in the vaccine program, which requires ever more hours of your time and ever more skills, patience, and what must seem at times to be the last remnants of human capacity to explain why vaccination is so necessary. The COVID virus is a formidable adversary, but due to your extraordinary efforts, it has more than met its match. Every day you have gone the extra mile to prevent illness, to relieve pain and suffering, to provide advice, care, and human kindness where they are most needed. Your work has been totally invaluable. The debt, therefore, we owe you all is quite simply incalculable. And on behalf of all those whom you have helped and those whom you will help in future, thank you for everything you mean to us.